is a patient with a BMI of 57, actually coming all the way from Iowa. This patient has been turned away from 4 surgeons who, because of the BMI, refused and rejected the patient for the surgery. As you see, patient has multi-level disease, but in the exam and in following diagnostic, we noticed most of the patient's pain and radiculopathy correspond actually to bottom 2 level. Obviously, the L5S1 is very easily visible, but there's a spondylolisthesis in 4-5. In 3-4, there is a disease as well, but that clinically contributed less to patient symptoms, so we decided to only go ahead and do the L4-5-5S1. The surgery was done yesterday, and I'm going to discharge patient today. So these are now the operative pictures. So initially we had a difficulty to visualize because of patient's high BMI. We did a series of taping that enabled us to get an adequate picture for the surgery. Obviously, you have to be very careful here. We see the disc base. I see the shadow of the pedicle, and here we are orienting ourselves. Our instruments were at the border of what they can do, but as you see here, we are able to practically visualize the proper structure. The Jamshidi goes in and we get some bone marrow. And this is when we start the surgery practically in the afternoon at around 2:46. Then we put another Jamshidi in. As you see, we are 2 Jamshidi in, and now we put as well the Jamshidi in S1 on both sides first. Now here we are approaching the disc with the probe, and we are stimulating the probe at 3 milliamp. Once you are in the proper place, we stimulate to 4 milliamp, then we enter it, and you see here how it lifts up, and practically you have a tube now that goes from the skin to inside of the disc. Now we do the performing discectomy, and now the cage is placed. Again, this patient has a BMI of 57. We started the surgery at 2:46, so 15 minutes later, the first cage is already in place, and 4 K-wires. Now we are moving on to the next level. Again, visualization is hard, but it's actually easier in 4-5 than 5S1. We are going there now. We are putting the screws or K-wires in the 4-5, and it was actually quite difficult to do this because of huge tissue we have to go through. But now, as you see here, the K-wires are placed. Now we go put the tube in the 4-5, same fashion. Here, something you need to see, you see a bend of the, I have to go back here, you see a bend. I have to pull it back, bring it back, and re-enter it. But then you see the discectomy, preparation of the end plate, and screw placement. So at this point, a P machine goes out, and you work only with the lateral machine, and screws will come in. Obviously, in the AP, you won't see that. You see in the lateral, first we decorticate the facet, we pack it, and the screws start going in. Patient has some segmental scoliosis. And then here you see that the rod is being passed and locked in place. That's the final lateral. This is the final AP. And in cases like that with high BMI, I get always a post-op CT actually. And that post-op CT I want to show right now. So, first of all, These are the lateral pictures. Spaces are more open, and then we see that the screws are all in adequate position. One of the screws in the L5 really approaches the end plate, but all the other screws are fine here. And here are the S1 screws. As you see, I choose to put bicortical S1 screws, which make them stronger. There is a talk from Christopher Shafri that advocate even iliac instrumentation for longer construct. This is a 2-level, but by putting a bicortical S1 screws, we are able to actually make it stronger. More or less, if you look at the surgical times, you see that the surgery here, the positioning, the skin cut start at 6 around this time, 2:46, and the final picture is taken at 3:36. In about 50 minutes, we have finished this surgery, and that is the advantage. These patients are not on their chest for hours and hours. And this patient today morning told me the leg pain is gone. I took a patient testimonial, and she will be discharged today. So after a 2-level fusion for a BMI of 57.